Are you ever concerned when your infant or child has a reflex or reflexive response at night when they're sleeping or during the day where they startle? I'm Dr. Linda Slack.
And I'm Dr. Kelly Began, and we are continuing our primitive reflex series. So today we're going to be talking about the Moro reflex, also known as the startle reflex, like Dr. Linda said. Um, the startle reflex replaces the fear paralysis reflex, which is what we talked about last week
Yeah.
or
So it's
last
no,
video.
yeah. And it when does it emerge? When does it replace it?
So it replaces the fear paralysis reflex around 9 to 12 weeks in utero. And then when it gets inhibited, or I like to say goes to sleep, because they never go away, they just go dormant. So when it goes to sleep is around 3 to 4 months of age, 3 to 4 months out of utero. And the reason why, or the thing that we see, the milestone that we see occur because that reflex goes to sleep, is that's usually when your infant starts to learn how to roll.
Okay.
So,
So we're going to talk about what is the Moro reflex. So it has three phases. The Moro reflex, the first phase of it will the infant will arch their back, they'll throw their arms out back as well. Their fingers will spread out and they may take a gasp of air. The second phase of this reflex is when then after doing that, their arms come in like this and they go into a more flexion mode and then out again to normal. The third phase is the recovery phase or the time where maybe the infant or child might need a hug or to be alleviated from that stress response.
exactly. And during these phases, if you see something like this occur, that's totally normal. That's exactly the response that's supposed to happen. But if it's abnormal when it happens after 4 months of age, or if they don't present with this when they're born. That's something that you would want to get checked out or go to your local pediatric chiropractor like ourselves.
So
Um,
how does it support development?
so it supports development, first of all, by starting with the birth process. It helps the baby engage in the birth process and allows them to have the energy, the support, the hormones allow the body to engage into the birth canal and then extend through the birth canal, going through all the twists and turns that they make while they're coming out. And then once when they first come out, it's what allows the baby to take their first gasp of air. So similarly, like Dr. Linda's just said, during that first phase of the Moro reflex, when they bring their arms back, spread their fingers, and then take that big gasp of air, that's what allows them to take that first breath of life.
And then finally, it allows them to stretch out and unwind and straighten their arms and legs because after being in that flexion position in the womb for 9 months.
Mm-hmm. And because of that, allows them to then learn how to sit up because they're getting that extension and then helps them with their support and standing.
All right. So, as Dr. Kelly alluded to before, after the first 4 months of life, where let's say that reflex was there and it did not inhibit or integrate into the system, it will cause delay or could cause delay in their developmental milestones of rolling, sitting, and crawling. The beautiful thing is that if you see this occurring or your baby's 6 months old and they're not rolling yet, the with care and exercise with a chiropractor, we can help the baby to get into that rolling phase again, and we can help to inhibit the Moro reflex, which is a beautiful thing. So that
Mm-hmm.
development will occur normally from that point on.
Mm-hmm. And as we've said in so many previous videos before, not even just in our series, but those milestones are extremely important. So it's important that one, have them be in order, but also have them be close to being on time so that the baby can develop as best as we can.
So if for some reason that reflex does not inhibit, Dr. Kelly, what happens when later on? What kinds of things will we see in the older child?
So in the older child, there's a myriad of things that could potentially happen. One of them is having sensory issues. Like we said before, because the Moro reflex it replaces the fear paralysis reflex, a lot of things are similar there. But bright lights again, like we said before, in our office, the lights above on our table are very bright, and some of our kids just cannot handle that, so they ask them to shut them off, or they'll put their hands over their eyes and then they'll just be like, I can't do this. So bright lights might be a problem, like Dr. Linda said last video. Being in schools, those fluorescent lights can be too much for your child and can be distracting, or it can cause aggravation. Changes in loud sounds. I'm sure you notice with your infant, if a loud door slams or a cabinet door slams, they might have that startle reflex. That's the same thing as an older child. They might not be able to adapt to those types of things. When they change their position because they're feeling that free falling motion, with their head changing in position, going from a lying to a sitting, that can cause them to have a startle reflex. Now, these startle reflexes, they get replaced. This thing called the Strauss reflex is the adult version. That's normal. Like you reacting, Dr. Linda or I reacting to a loud noise, that happens. Like if you have a loud noise out of the blue, of course I'm going to get startled, but it's that thing that happens way too often, even with something that shouldn't startle you. That's the difference, because as adults we do have that reflex. It's still there, but it's the repetitive, it's the hyperactiveness of it. Other issues that could occur are behavioral changes, things like aggressive mood swings. The child tends more towards the aggressive side. They have higher anxiety. What else can you think of, Dr. Linda, that we see in older children?
Yeah, these are the children that you really need to have a family calendar or sit with them in the beginning of the day and tell them what the day is going to look like, what you're going to do through the day. They can't handle sudden change. So let's say you were supposed to take them swimming in the afternoon after school and swimming got canceled and you're like, "Oh, we're not going to swimming. We're going to go to the supermarket and get groceries." The child would probably have a tantrum at that point.
Exactly. And similarly, with those change in positions, that might also cause balance problems, or then relate to them not being able to perform as well in sports as their peers, which can be discouraging. So you want to go to your pediatric chiropractor. You want to go to somebody that can help negate that, so your child can, one, develop the best that they can, but also so that they can perform their best and not feel discouraged because they can't do it. They can do it. They
Yep,
just don't know what's stopping them.
exactly. And ideally, it would be best to catch this early on, like in the infant stage in the first year of life, when you see them not meeting their milestones, that you know that's your red flag to know that something's wrong. To the earlier we correct it, the better. But the beautiful thing is with any of the primitive reflexes, if they remain present after they should, and they cause these issues, they can be integrated. So that's the important thing to know, that if they're not there permanently and there's not going to be a permanent deficit or developmental delay with the child, that we can always reverse it, which is a beautiful thing.
Exactly. So come on down.
So what does one thing we failed to mention is that the Moro reflex also helps with the development of the next reflex we're going to speak about, the spinal Perez reflex. So um, in our next video, our next reflex to talk about is the spinal Perez reflex. So stay tuned for that
Mhm.
and look forward to it.
Bye.